Hi, this is varicocele surgery failure part 6. I'm Mike Chartrand, and this video is mainly a discussion of the literature in video 6, plus I'd like to add some of my own ideas and then discuss kind of a controversy I see amongst medical people. First, I'll show a little bit of a diagram of the spermatic cord and here, and I'm going to be talking about the spermatic cord as the veins here come up and they kind of bottleneck as they go into, and the spermatic cord goes into the inguinal canal. Here's the intercrural fibers, which are basically connected to the abdominals, obliques and abdominals, and kind of has a hard time pulling up here, I think, and that could be part of the reason why people feel punched in the gut. So, we'll go on here. Some of my own ideas. Olson and Stone talk about traction of the spermatic cord. In high-grade varicoceles, the left testicle usually hangs below the right. My testicle drops down into the center and basically twists the scrotum, so that you could see how this could lead to scrotal pain. And there's an example of this in video 6 at the end. The veins from the left testicle would be, since it's twisted this way, the veins from the left testicle would be pushed against the veins from the right testicle when walking and strumming it basically like a guitar string. These veins enter the body and go under a fatty layer, which will squeeze the spermatic cord when walking and jostle the dilated veins. I'm talking right here, this part. It goes under the fatty layer here and then pulls it up into the inguinal canal. And so as the person is walking, these will be kind of jostled in the fatty layer there. In order to pull the testicle up, the cremaster and scrotum have to directly squeeze the varicose veins, which are already bottlenecking as they go into the body, and again under the fatty layer, and again as the veins flow into one single vein, they bottleneck again before they go up to the kidney. This would cause the veins to further dilate when they're being pulled in towards the body. This would be more painful, make the varicose already dilated veins, sending a signal to the brain for the cremaster to stop pulling up on them. And at the same time, the nervous system would also be telling the cremaster to pull up to regulate temperature. So it's a contradiction in what the body's telling because of different kinds of pain and instincts there. The skin behind the left testicle is bunched up, as you can see in video 6 at the end, and will be pinched between the butt crack and the right glute as the man walks. Basically, it bunches up there on the right side. I showed that in video 6. The supporting ligaments and midline raphe could also be being twisted with the scrotum. Varicocele is commonly described as a pulling and a dragging feeling. I respectfully believe that urologists are expert in everything from the kidney to the urethra, but far too little respect is given to simple physical changes caused by the varicocele that I was just talking about. For a man with advanced physical problems and collateral veins, and I'm referring to Campbell's textbook section on soldiers who can't do their jobs, workers, and men with fatigue, anxiety, and general disability, inguinal surgery without a proper venogram is probably worse than a death sentence. Collateral veins can be missed without a venogram. Now I'm going to briefly discuss the points in video 6. Varicose veins are commonly described as tortuous. The Mayo Clinic describes them as sometimes causing aching pain and discomfort. Varicocele is most often described as a dull, achy, draggy feeling, sometimes as a heavy sensation with increased heat. It is described as a pulling in the groin or a throbbing. Olson and Stone states that it causes disability amongst thousands of workers worldwide. It's often associated with manual labors, heavy lifting, and standing throughout the day. We know that varicocele surgery increases sperm count and testosterone levels in men with high-grade varicocele. Orchialgia is testicular pain. It's attributed to torsion when the spermatic cord or blood flow gets cut off, but it is not directly associated with varicocele. Probably should be, because decreased blood flow away from the testicle is probably a reason for atrophy, if not orchialgia or testicular pain, which is the first concern my doctor showed when I sought another opinion after the surgery. Anyway, the symptoms of orchialgia are sharp pain, deep ache, squeezing in the testicles like the day after you got kicked there, pain in the inguinal area, low back pain related to heavy lifting, jogging, sitting at a computer, driving, and lumbar lordosis. So, and you can see those are some of my symptoms I talked about in video 1. So I'd like to point out a stigma that I see in the literature on varicocele stemming from Campbell's urology textbook, volume 1, which I believe has been and is still being passed down by urologists in Manitoba and likely elsewhere who use that textbook. And it's a general stigma that just came out of the past for no reason. Prejudice, basically. The textbook states that, without any evidence given, that patients often have a wide variety of unrelated complaints. It lists impotence, nervous instability, fatigue, and general disability. Then it says that patients often have a smaller testicle. This is the contrast, which seems unreasonable, that they complain of these things, and then it says that the patients often do have a smaller testicle on the varicose size. Then it says that testicular atrophy is often associated with a large-sized varicocele. The textbook is literally saying that testicles with varicocele often atrophy or are smaller, but anxiety, fatigue, and general disability are completely unrelated to the varicocele. It's like saying, sorry, your testicles are dying, but that's no reason for anxiety. The pain is all in your head. You're not producing testosterone, but that is no reason for general fatigue. Your testicles dying, and the blood is stagnating there, but your abdominals would not be straining to regulate temperature and blood flow. This is no reason for general disability or constant discomfort. At least your discomfort should not be very bad, because most men with varicocele don't have these symptoms. But what I'm saying is that since I was dragged down when I took off the scrotal supporter, and I have a large left varicocele and a small right varicocele, why would it be considered psychosomatic? Why would the urology community not treat varicocele, especially extreme ones, as a progressive, and bilateral ones, as a progressive condition that drag some men down eventually, while other men are able to deal with it, or, to their knowledge, are not affected at all because it is not severe enough? And remember that Olson and Stone say that all men with varicocele have symptoms if examined closely enough, and if it's not, I would say if the symptoms are not discounted. I also would like to point out what seems to be a point of division between doctors about the effect of varicose veins on muscles. I was referred to the rectal surgeon who diagnosed me with levator syndrome by a walk-in clinic doctor who is familiar with my varicocele and hemorrhoid issues for a long time. She was also familiar with the way I lean back on my seat in my scooter, and that I find it very difficult to ride there to medical appointments. She noted that many women have varicose veins after pregnancy, and these types of problems, such as I have, holding myself up and bouncing in my scooter. Another nurse described the problem that women after delivering a child find themselves tilted to the left or right and have difficulty balancing each section of their spine. And you can see the photo of myself leaning to the left in video 1. The physiotherapist who treated my levator syndrome, who the spinal surgeon referred me to these physiotherapists, and they say they also describe levator syndrome that women have after pregnancy as being caused by varicose veins. The levator muscle is on either side of the anus and has increased tone and won't release. This is what causes the pain when I'm hitting bumps on the scooter or when I was driving transit bus in 2001. Now the controversy is that medical doctors do not seem to accept this. My rectal surgeon did not recognize the story that my referring doctor had told me about women and pregnancy. If he did recognize this, it would make a direct link between my association of the varicose spermatic veins with my abdominal muscle failure and my original muscle imbalance from the varicocele, the toxic blood, and the hesitancy of the cremaster muscle to squeeze them. This is a driving force in my thinking in these videos, and you can see my shower story in video 4 part 2. Instead, he said that there was no link. The surgeon said that diagnosed me with levator ani syndrome, said that there was no link between the varicocele and my back problems. Or the back problems which he associates with levator ani syndrome. Instead, he said that levator ani syndrome often happens after car accidents and are associated with back pain. But I never had any type of major accident, so it's not from that. So, if you've had varicocele surgery and it hasn't worked for you, or if you have pain or infertility and are considering surgery, I hope this helps you. Also, there's been an interesting development I'll talk about in part 4 of my story. According to the Winnipeg Regional Health Authority, I will be referred to Dr. Keith Jarvie at Mount Sinai Clinic in Toronto. Alright, so again, I hope this helps somebody out there. Thank you.